Good morning, Lake Providence Church family. This is Dr. Linda Plummer Ward. And hey, welcome back. After much prayer, discernment, and vigilance, Lake Providence Church reopens her doors for congregational worship by registration. So welcome. While we recognize that the pandemic is not over, we are so thankful for God's grace and mercy and for keeping us thus far and bringing us to this point. And we continue to pray for all who suffered losses in any way during the pandemic, especially those who suffered the loss of loved ones. We also continue to pray for healing for those who suffer from long COVID. And now that we have vaccinated a majority of those 65 and over, the rate of hospitalizations, ICU admissions, and deaths has stabilized in that age group. Hospitalizations and severe disease in adolescents and young adults and those up to age 65 has actually increased. Hopefully with vaccinations, that trend will also stabilize. As we previously discussed, the longer the virus has the opportunity to spread and the more of us it has to choose from, the more it will continue to evolve new variants and spread the ones that are already in circulation. Let's not give it that opportunity. This is not a wait and see kind of thing. This is a battle that we're in the middle of and we're trying to win it. We've had over 33 million cases of COVID-19 in the United States, over 593,000 deaths so far. Over 299 million vaccines have been administered in the United States. That has brought us down from about a peak of 225,000 a day in January cases, 225,000 cases a day in January to now about 16 to 17,000 cases per day. People, younger ones that is, are still getting sick and dying, more so now than the older generation. Fortunately, it's not occurring at as fast a rate as what we saw with the elderly. 52.5% of the U.S. population 18 and older are fully vaccinated. 63.4% 18 and older have had at least one dose. 41.6% of the whole U.S. population, that's about 138 million people in the United States, are fully vaccinated. Tennessee is lagging behind in the number of vaccinations. We are considered at medium risk for contracting COVID-19 in Tennessee. 41% of Tennesseans are fully vaccinated and 47.3% have had one dose. Of all those who received at least one dose, fewer than 0.001%, 1/10,000th of a percent, experienced a severe adverse reaction. Severe reactions to vaccines usually will occur in the first 4 to 6 weeks after vaccination. We've been watching that very carefully, and the numbers are extremely low. 1/1000th of a percent. Messenger RNA vaccine effectiveness proved to be as good in real life as in clinical trials. SARS-CoV-2 and its variants, regardless of where it came from or how it got here, it's still with us. When we gather, especially indoors in large groups, it's advisable to wear a mask unless we can be absolutely certain that everybody is fully vaccinated or that there's no vulnerable among us. And there's no way to know that for certain because our health information is private and protected. COVID-19 is not a disease that we want to experience. Even healthy people who are not vaccinated can get sick and die from it. We are unable to predict how severe of an infection we would get if we got it. Long COVID, involving prolonged symptoms from COVID, can affect anyone who gets COVID-19. And the risk of an unvaccinated person unknowingly infecting a vulnerable contact can be tragic. So while we're doing better in some areas of the country than others, let's remember to be vigilant, especially while you're traveling and while you're gathering in large groups, in particular indoors. We have not reached herd immunity. If we get COVID, we don't know how effective the antibodies that we get will be or how long the effectiveness will last. Nevertheless, there's hope in the air. There's a sense of calm because a couple of major stressors are not as overbearing throughout the land. We won't call any names. But whether we worship in person or online, remember to be thankful for all that God has done and what we know He will continue to do. God bless you, my sisters and brothers. As always, stay safe, stay healthy, and stay prayed up.